The Ontario government is expanding a take-home PCR test program to include all 4,800 schools in the province. The test will be used by close contacts of a confirmed case or those who have COVID symptoms.
More rapid tests will be available soon, too, at schools with multiple cases. Joining us on CP24 tonight to discuss these latest strategies to keep schools safe are Kate DUPUIS and Regina BATESON, parents who've been advocating for rapid tests in schools, and Raywat Deonandan, an epidemiologist with the University of Ottawa. Thanks to the three of you for being with us tonight. Kate, I'll start with you. When you heard there was going to be an announcement with the Education Minister, is this what you were expecting?
Quite frankly, no. I was really hopeful that the Minister of Education today would announce that vaccination against COVID-19 would become mandatory for all those working within education settings, not only schools but also daycares, and that vaccination for children, once it becomes available, hopefully very soon here in Canada, would also be added to the list of numerous other mandatory vaccines that we already have to prove our children are protected against in order to enroll them in schools here in Ontario.
So, Kate, that's not, you're disappointed in terms of what you were expecting, but I want to point out that you were and have been part of a program at your children's school in the city's East End to bring these rapid tests to the schools so that kids can be tested. If you want to share with us, are you satisfied with today's announcement, and what holes do you see in this announcement, because it's not quite consistent with the program you've been carrying out?
It's really strange because, quite honestly, I've been pretty enmeshed in this testing discussion for the last 2 months, and I don't really know of a lot of parents who've been asking for take-home PCR testing kits. I think what a lot of parents were asking for was the ability to access for free rapid antigen tests, which we could use for children who are asymptomatic. So we know that about 50% of the cases in kids, they don't even show any symptoms. And so the whole idea behind rapid antigen tests is that you test your kids a few times a week before they go into school, and if your child does have a positive test result on the rapid antigen test, then you send them to a hospital for a PCR test kit. The thing with the announcement today, which I think follows very closely on the heels of Toronto's announcement earlier this week, is that now parents can go to their school to pick up a PCR testing kit, do the test at home, but it's not actually an at-home test, right? It still has to be returned somewhere, possibly a school. The announcement today said select pharmacies, a test center. So I don't really know where this push was coming from. I don't really see a lot of chatter online around this particular type of testing. I think what many of us were asking for was a preventative measure. These PCR tests are for kids who are asymptomatic or have been exposed to a child who's positive for COVID-19. We want to try and stop cases from getting into schools.
Raywat, I want to ask you about the effectiveness of these take-home PCR tests. The idea being sold to us by the Education Minister is that they're more convenient. It doesn't require that you book a test for your child, for example, that you have to take them to the test and then wait for the test result. But it also requires that the parent or caregiver of the person or the child who's showing symptoms or potentially is a close contact goes into the school then to collect the test, and then they have to go to a secondary location to drop off the test, as opposed to, one location to get the test, back home, wait for the results. Is there any sort of science that says this type of test is maybe more effective than heading to a testing center?
It shouldn't be more effective necessarily. Do keep in mind that parent still has to apply the test, so there's going to be a little bit of a failure there as a non-expert applies the swab. That's true for the rapid antigen test as well. There is a slight advantage here in convenience. You don't have to wait in the testing center to have your kid tested. That could eat up hours of your day. You have to drop it off, sure. There is some advantage in convenience, but it's not a game changer. This is not what we need, frankly, to really alter the landscape of COVID outbreaks in Ontario. It will help, but not a lot. What we need is rapid antigen testing at scale. We need ventilation, we need a vaccine mandate, all those other fun things.
Regina, so how do you feel about today's announcement as someone who was pushing for a program that Kate initiated in her community? You were pushing for the same thing in your Ottawa community.
Yeah, so what I heard today as a parent is a really disturbing acceptance of the fact that there are going to be outbreaks in schools and, potentially large-scale outbreaks. And what I heard is a little bit more convenience for parents after that happens. Whereas I think what a lot of parents want is to prevent those outbreaks in the first place. And that's where rapid antigen screening for asymptomatic kids in a widespread usage and vaccine mandates would have really made a difference. So that was concerning to me. I also think that mass infection of school-aged children is not a good policy for the rest of society either. I worry about grandparents, folks who are seniors who are out in the community who are not eligible for third doses of their COVID vaccines. And I worry about the high level of spread among kids right now. I mean, in Ottawa, the rate is 71 per 100,000 kids aged 5 to 11 per week, compared to 9 for adults. So there's really a very high rate of spread still among children, and I think that should concern us all.
Raywat, as the epidemiologist on the panel, we've heard Regina's concerns, Kate's concerns about today's announcements, and yours about, I'm going to call the gaps in today's announcements. Why do you think the government and the Ministry of Education chose to move forward with this, their announcement today, as opposed to what some of you here on this panel are suggesting, as those who have been also heavily invested in this topic?
I think it's low-hanging fruit. I think it probably costs a bit less to deploy these tests. It doesn't shake the apple cart much. Buying large numbers of rapid antigen tests and setting up screening programs in schools can be burdensome, and maybe they don't want to do the work. And there is some pushback from some experts suggesting that this juice is not worth the squeeze. I disagree. I think the juice most definitely is worth the squeeze. With these rapid PCR tests, the advantage is that it speeds up, in principle, in theory, the confirmatory PCR testing after a rapid antigen test has possibly flagged someone as being infectious. But frankly, you don't need confirmatory testing for many cases. I think that's a misunderstanding of how to deploy this test-to-stay situation to great effect. But if we're going to use confirmatory testing, then this will help a little bit. But again, it's not the biggest, most important, impactful application of our resources.
Raywat, I wonder what you can provide in terms of an overview of COVID-19 in the school system right now in this province. Are you worried? I mean, it sounds to me as though there are steps that we could take to make it safer by offering more rapid tests to more people, making them widely available. But it doesn't sound as if that there's a sense of urgency from the government. Would you be operating with a greater sense of urgency?
I would. I think there's an assumption that vaccination will save us, and vaccination will save us, but not until some people suffer unduly. So right now, about 40% of all new cases are in elementary schools. The case rate in 5 to 11-year-olds is like double other age groups. So that is definitely where the growth in cases is, not surprisingly, because that's where most unvaccinated people are. So what we need to do is have a good mask mandate using high quality masks. We need to have good ventilation. We need to have good symptom checks. We need to have rapid antigen tests to keep infectious people out of the school system. And we need a vaccine mandate to make sure any adults these kids come into contact with will not provide and introduce infection to them. There's so much we could and should be doing here. Now, when vaccination becomes available for younger kids, the situation may change measurably. Until then, we have tools on the table that we're not using, and it's a little confusing why we're not using them to a greater extent.
Kate, just to wrap things up with you and Regina here, I imagine you will, of course, continue the program you're carrying out at your school and at the school your child attends in the city's East End. And Regina, if you could give us the latest on your efforts in Ottawa.
Yeah, so we've really hit a wall. I've had some back and forth communication with Ottawa Public Health. They seemed interested a few weeks ago in trying to move forward with whatever rapid tests were promised by the province, but the province really downloaded that responsibility onto the health units, and it doesn't seem they've been given much support to actually implement the rapid antigen screening. So, I have gotten back in touch with them and said, we have a lot of parent volunteers, dozens who are ready to go. Can we help with this in some way? And we haven't gotten any communication back. So, those efforts are a bit stalled, but I would say that a lot of us are really looking forward to vaccinating our own kids and really hoping for a vaccine mandate that's more widespread for staff in that education setting.
Raywat, we have maybe 30 seconds to get to this last question, and I want to pick up on what Regina just said there about widespread vaccines for education workers. Another signal today from the government that that's not going to happen. They're upping the weekly test to 3 for those who are not vaccinated. Is that good enough?
Frankly, we don't know. Have no idea. Yeah. It probably is good enough to some extent, but it's not sustainable. At some point, they have to get vaccinated.
Thank you. Kate, I apologize. We ran out of time here. Yes or no, you're continuing with the program at your East End school?
We will until we run out of tests. Yeah.
Okay. Thank you so much, all three of you. We appreciate you coming on to talk about, once again, this important topic tonight. Thank you.
Thank you.
Thank you.